I'm Dr. Ben Talei, a facial plastic surgeon in Beverly Hills, California, specializing in minimally invasive natural aesthetic procedures to the face, such as modified deep plane facelifting known as the Aura Lift, the modified upper lip lift, minimally invasive rhinoplasty, and other non-surgical procedures to make the face look natural, refreshed, and more youthful. Alright, so we've got Stephanie here.
So I came in to get my lips done with Ben.
We actually have not done much on her at all. It's tiny, tiny little things. What we did was we touched up the lips just that one time.
Yeah.
And you already had a good lip, so we didn't need to put much. I actually just put like, I think even half a syringe. It wasn't much filler.
He used Restylane, and I know that a lot of my friends used to get their lips done and they get Juvederm. Like, I've had a lot of people like offer to do my lips, but I will never go to anyone but Ben because I always see a lot of girls' lips and they're really like lumpy and they look really fake and hard. And my lips, like, literally everyone always asks me who did them because they look so natural.
You said like, okay, maybe can you clean this up? Do you have any way to do it easily with no problem or something?
I told him that I wanted to get laser under my chin, and he suggested I do lipo. And at first I was really scared because lipo just sounds really scary and like you have to be under. And then he told me that I didn't even need to go under to do it.
And so all we did was micro-liposuction, which is the tiniest little stab here, and I contoured it by getting rid of a little bit of fat, and it stimulates the skin to contract upwards, so it actually tightened the whole jawline and gave her more of an accent all the way across. In my practice, I have the fortune and the challenge of seeing patients just like Stephanie who come in, and when you look at them, it's very hard to imagine what they need. They already look so happy and so good. And it's not until they start telling you the things that they've noticed and that bother them that you start to kind of pick it out yourself.
I used to have no definition on my face, like everything just like was one. And after he did this procedure on me, now I have definition and a jawline, and every year, because I got it done 2 years ago, every year like my face slims down even more in this area.
With Stephanie specifically, what we did was something called micro-liposuction. It is a very, very minimally invasive type of liposuction that's done under the chin that works a little bit more effectively than Kybella and is not as traumatic as classic liposuction. More recently, we've combined it with a procedure called profound radiofrequency, where we can do skin tightening as well, and now we can actually improve above the jawline and get even better improvement all along the neck with less risk. Once we did that, then we said, okay, we'll just touch up a couple other things on the face just to look a little more refreshed. Afterwards, I usually see patients a month later and I do a little bit of touch-ups like I did on her with fillers that are very safe, they're reversible, and it's exceedingly rare to see any problems with those types of things. And then we just did a tiny little bit on the upper cheek here to raise up the accent, which worked nicely in photos and on camera and stuff. It just made you look like a little more, I think you had like baby cheeks that were down here.
Yeah. And
so it just made them look like a little more elegant. And that's it. For people like her who are going to be on camera and just want to look a little bit fresher and better, it's a really great option. You didn't need a big change, but it was enough that I think it looked good right away. And so the patients I've been seeing recently, very fortunately for me, have been coming in wanting more natural things done to them. They no longer want big, puffy, fake-looking lips, overdone, drawn-down cheek.
He used Restylane, so I don't know if that's why they look more natural. I don't know.
Fortunately now, I've been able to hone, I'd say, my skills in the way I do things in order to give patients like her the improvements they want in a very natural and subtle way. These things were a bit of a fad, unfortunately, for a while, especially in Los Angeles, and now more and more I'm getting patients come in and they just want to look like a better version of themselves, and we're hearing that more and more. I just want to look better, I don't want to look different. We see a lot of this in LA, patients who are either professionals or they're on screen or they are photographed a lot. They notice minor things that wouldn't be noticed otherwise. In real life, there are things that really don't bother people, but we live in a digital age now. And fortunately, with the methods we have, we can offer patients minor natural improvements that nobody else will ever notice.
I will never go to anybody else but Ben.
It looks even better now because it just kind of kept slimming.
It does. I'm really happy.
But overall, you think it's all good?
Yeah,
happy with everything?
Yeah, especially my chin.
And I look at you and I'm trying to figure out things to do, but there's really not much. So it's unfortunate because I like to use needles on everybody's faces.